right, well, welcome everyone, and thank you for joining us today. Today's webinar session is all about understanding the return on investment of smart waste and linen automation, specifically how these systems can cut costs, ease staffing burdens, and help healthcare facilities use their space more effectively. Please feel free at any time to ask questions through the Q&A tool at the bottom of the screen. We will have time at the end to address and answer all of these questions.
New to our webinar series, and a reminder to those who have joined us previously, Envac is the global pioneer in automated waste collection, with a presence in 20 countries, over 750 employees, and more than 1,200 installations. Our systems serve over 6.6 million users daily and are backed by over 60 years of experience. Today, you'll learn 4 key things: how automation leads to operational savings, how it relieves staffing challenges, how it enables smarter use of valuable space, and finally, we'll walk you through a real-world case study with a detailed ROI breakdown. Why ROI matters now. Healthcare operations are being squeezed by labor shortages, rising costs, and limited space. Automation isn't just futuristic, it's practical and urgent. This session will show you how hospitals can capture tangible savings and unlock hidden value.
Currently, the most common method of transporting waste and soiled linens in healthcare facilities is entirely manual. Nurses and staff first collect bagged waste, recycling, and linens from patient rooms and deliver them to designated holding areas on each floor. A second staff member then maneuvers large, heavy push carts full of bags throughout the facility, carefully navigating through corridors en route to an open elevator that they then take to the loading dock to unload. This labor-intensive process runs continuously, 24 hours a day, 7 days a week, 365 days a year. In contrast, pneumatic systems automate the movement of waste and linens within the facility. Staff members collect waste and linens from each room, as per standard practice, and can immediately deposit them in a conveniently located material inlet chute positioned strategically throughout the floor. Materials are then transported through sealed pipes to a central location, faster, cleaner, and with less human intervention. By removing the manual handling of these materials, staff can focus on higher value tasks. In our hospital case study, this leads to a 75% reduction in labor needs dedicated to these activities alone, saving $270,000 annually. That's equivalent to 7.5 fewer full-time employees that do not present the added challenge of turnover and retraining.
So let's talk about space. Traditional systems require staging areas, cart pathways, and possibly additional elevators. Pneumatic systems reduce this footprint, enabling facilities to reallocate that space for revenue generating or even care enhancing functions. These images do a great job of reflecting the spatial differences you would expect to see in a facility using traditional waste management methods versus an automated pneumatic system. Notice the material holding room reallocated to patient care space, the elimination of a third elevator, and the ability to provide larger patient and staff spaces by making the hallways more narrow. Automation empowers architects to be more creative and efficient. Recovered space can mean more patient beds, improved workflow, or better amenities for staff, creating direct and indirect returns. It's important to mention that space utilization through the elimination of waste holding will also lead to a cleaner, more aesthetically pleasing environment within the facility. Pneumatic systems reduce elevator use and overall infrastructure wear. Reduced cart traffic throughout the facility leads to longer lifespan of the hallway surfaces and many expensive doors that are commonly damaged due to contact with heavy carts. Facilities that rely on motorized vehicles to move carts through the basement level or even exterior of the building no longer need to operate and maintain these pieces of equipment when using a pneumatic system. As a whole, this leads to a significant savings in facilities maintenance and prolonged system life, estimated at a minimum of $28,000 per year in one facility.
An important added benefit of automation is improved hygiene. A recent study by the KTH Royal Institute of Technology in Sweden found nearly a 50% reduction in average microbial colony forming unit count in a facility that implemented a pneumatic waste and linen system as opposed to implementing traditional material management methods. These results suggest that automated waste handling can significantly enhance hospital sanitation and support better patient safety outcomes. This will impact staff satisfaction and safety, which in turn leads to less use of employee sick time and promotes higher employee retention. An automated waste and soiled linen handling system also helps address staffing challenges. It reduces reliance on physically demanding roles, supports infection control, and minimizes injury risk, all important in today's competitive labor market. Filled staffing positions leads to higher revenue potential, while higher employee satisfaction and safety drives a real return on investment for a pneumatic waste and linen system. Automation frees up floor space, making room for staff rest areas and wellness rooms. I recently learned at a healthcare industry event that the need for staff decompression rooms is crucial in a post-COVID environment. Reallocation of space given back to a project that utilizes a pneumatic system to incorporate these types of areas within a facility is a great means of space utilization, as previously mentioned. As hospitals compete for talent, these perks contribute to staff satisfaction and retention.
Let's take a look at the bottom line. In a 200-bed model hospital with one tower, annual savings total $333,000. After subtracting system costs, the net return is over $240,000, with a short payback period and compounding benefits. This slide shows the labor savings in detail. By automating transport, the facility eliminated 7.5 FTEs. That's a reduction of thousands of staff steps per day and 270,000 saved annually. Next, equipment and maintenance. Fewer carts mean lower equipment cost, and less elevator use saves nearly 28,000 annually. Together, that's over 39,000 in yearly savings. As the KTH study shows, pneumatic systems also improve environmental health. By containing waste transport, they reduce pathogen spread, leading to fewer sick days and potentially lower insurance premiums. This equates to a reduction of approximately half a full-time employee, or $26,000 annually. Of course, there's a cost to automation. Energy, maintenance labor, materials, and IT support total just under $92,000 per year. But these are far outweighed by the benefits we've presented. Once you subtract operating costs from the savings, the facility nets $241K annually. And that's not even counting the added value of increased patient care space or improved patient and staff satisfaction. The system provides a cleaner, healthier environment for the healthcare practice, as well as an aesthetically pleasing and odorless experience for all patients and employees alike. Reallocated space and improved logistics promotes a streamlined handling of outbound materials and brings the ability to implement staff decompression rooms or areas into the project.
In conclusion, Pneumatic automation is a proven way to reduce costs, ease staffing burdens, and enable more flexible hospital design. It enhances safety, hygiene, and overall experience, delivering value now and into the future.
Thank you for joining us for today's webinar on the ROI of automated waste and soiled linen systems. We are more than happy to field any questions at this time. And please continue to join us for future webinars in this series. Looks like there's a few questions, Connor.
Yeah, I guess I'm gonna start with that first one. Let's go ahead.
What's the average cost of a system? I mean, that can really vary, but what do you think? If you go from a single tower to multi-tower, somewhere between $2.5 to $5 million?
Yeah, I think that's a spot on estimate there, Tom. I think, like you said, everything's custom when it comes to these systems. Not, there's not a one size fit all. Every hospital has different needs and every project has different requirements. But I think, like you said, for a single tower facility, probably that 2.5 million is a good estimate. And then to that multi-tower, like you said, upwards of 5 or really, above that is really just dependent on the scope and extra added benefits, if you will, that you may want to throw into a system.
Yeah. Hey, this next question is return on investment, ROI. I think you're best to take this one.
Sure. Yeah. So question is, how many years does it take for the system to pay for itself from return on investment? It's a great question. Obviously, one of the main points of today's topic or conversation. But we typically see with our projects or projects of these type a 5 to 8 year return on investment. That's through reduction in labor and the maintenance and equipment costs, like we mentioned through this presentation. Obviously, it's a case-by-case basis. Again, not a one-size-fit-all type of solution for every hospital, but most seem to fall within that 5 to 8 years. If there is, a specific case in mind that anyone would like to review with us, we'd be more than happy to take a look at your facility, your project, and really work out what an ROI would look like for that specifically.
That makes a lot of sense. This next question is this technology an economic solution for hospitals of all sizes, or is it better served for larger facilities only? I think that's a big misnomer in the industry that you should only apply this to large regional hospitals. I mean, some of our most successful installations are or happy customers are in smaller hospitals here in North America and around the world.
Yeah, I think that's well said, Tom. I think obviously our case study represented a 200 bed facility, but like you said, we know of one very happy customer, successful system in Sweden that has 90 beds. So can really range. I think it's maybe intuitive for people to see, when you get to the larger facilities with multi-towers, multi-beds, hundreds of beds, it really starts to add up and make sense. But that being said, it's certainly worth considering and looking at for the smaller facilities as well.
I mean, you're still getting the opportunity to translate non-productive space to patient forward, capability. So, and that's regardless of the size of the hospital. Yeah.
Yeah, and I think too, perhaps, if you think about the smaller facilities as well, perhaps, again, maybe I'm putting pieces together here, but smaller facility, maybe less staff, which means that more staff have to do more than one task. So perhaps the nurses have more responsibility with handling waste and linens, and that's exactly what we don't want to happen, right? We don't want to take the patient care providers away from providing patient care. So I think certainly that's a perfect example of in a facility where it might be smaller and people have to wear more than one hat or have more responsibilities. Just taking one aspect of someone's job responsibility away and giving them the ability to reallocate that time to patient care is ultimately like the goal, what we're trying to accomplish. And I think that can be done on a system of any size or a facility of any size.
Yeah, excellent point. Yeah. You want to
So why
grab that?
would
Yeah, go ahead.
Yes. So why would a hospital choose this technology as opposed to AGVs for reduction of manual labor? So it's a great question, and honestly, and I think Tom would agree with me. From our perspective, really the best or the most robust, thought out facility would actually implement both technologies, right? I think there's the opportunity for us to coexist in a project. AGVs are great tools for inbound logistics, bringing in linens, clean linens, materials, things to each floor makes a lot of sense. That's when you have a nice stacked cart, everything fits on there nicely. But where our system really shines and I think offers an advantage over AGVs is that outbound materials. Again, thinking of the linens more specifically, um, you have a nice tidy stack of linens coming in that's on one AGV cart. By the time the linens are soiled or dirty, you now have 3x the volume. Those linens just get balled up and thrown into a bag. So if you had one AGV coming in, you need three AGVs coming out. That's kind of one of those things that maybe gets overlooked when deciding the functions of those units. I
Phase
know,
two.
yeah, space
I'm sorry, I didn't
exactly.
mean to cut you off, but
No,
yeah,
yep, for sure. So we talked about how our systems can help reduce the size of storage holding areas for these materials. Well, you have to allocate space in a facility to clean AGVs, store AGVs, charge AGVs. So there's specific rooms dedicated to just these pieces of equipment. Um, that's a big chunk of real estate to a project as well. So that's something that really needs to be considered. And um, just the life cycle or the maintenance life cycle of AGVs. Honestly, if you look at it, well, you're gonna spend more to maintain an AGV than you will, or a fleet of AGVs rather, than you will for the maintenance of one of our systems for outbound logistics. So, um, great question. I think there is a use for those pieces of equipment for inbound, but I think our system really alleviates the needs to rely on those for outbound, and would really recommend, for big projects or any project, looking at both technologies to consider like a hybrid approach where we're outbound and AGVs are inbound.
yeah, I
Kind of a
couldn't
long
agree
answer, but
more.
I think there's a lot to consider there. So.
I think you're spot on now. What is the lifespan of one of these systems? Will we have to replace expensive components at some point in the future? Um, so we design these systems around the useful life of the hospital. So, you know, typically we see that as about 50 years, and the equipment is designed to operate over that lifespan. Obviously, there's standard maintenance um, that needs to occur, but there really shouldn't be the need to replace expensive components on a system that's well maintained and serviced throughout its life.
Yeah, and Tom, if I can add, looking at the history of Envac and this technology, so the first hospital Envac installed a system in was in 1961. That's hospital still in operation, and the Envac system is still a part of that hospital and operating well. Um, the technology, using that same example though, 1961, of course, things have changed in the last 64 years. So uh, automation has improved and things have become more efficient, and that's where a system can be upgraded, right? And that infrastructure of the pipe, that pipe network that's put in, the tubing throughout the facility, that won't need to be replaced. That's really, your backbone, your main infrastructure. But there are things that can be upgraded over time. It's in 20 years, perhaps, your control system, it just makes sense to upgrade because there are new ways to make this smarter, more advanced, or automated, or there are more efficient motors or drives or things like that can be upgraded down the line. But that's not to say you need a whole new system. That infrastructure that's put in place can be added to over time as the facility grows as well and the demands change. So
Yeah. That's really well said, Connor. And it's a choice, right? Because what I think you would agree with me is that the system will run, but maybe you can gain efficiencies and a better ROI on further investment in enhancements or improvements. That's spot on, bud. That's well said.
yeah. All right. And we got a question: what waste fractions can be handled? Great
Cannot, it says
question.
cannot be handled.
Oh, cannot be handled. So I'll answer both of that, right? So that they cannot the I'll answer it by saying what can be handled. So, we handle waste, recycling, linens. We even do red bag waste in 2 hospitals in Europe. We have pneumatic systems that move the red bag waste from your sharps containers, things like that, um, from each floor down to a processing unit in the basement. Uh,
And hopefully in the near future, we'll be doing that here in North America with,
right.
yeah.
Exactly. Yeah, I just wanted to add, that the fractions, um, waste and recycling are pretty, here in North America are pretty generic terms, but we can segregate that or separate that as the hospital sees fit. If you want to separate your plastics from your papers, things like that. It can be done. Um, Here in North America, we tend to just kind of take everything as one source of recycling, but certainly can be separated further. Um, Now we aren't taking, your radioactive waste or anything like that. But again, when we say red bag, we mean your sharps, galls, things like that, of
But
that nature.
But that stuff that we don't take, that's where the AGV comes in, right? So we don't want to take cardboard boxes. We don't want to take, broom handles necessarily. Um, but but you but in combination with the AGV system, that's where those things can be transported out of the hospital with
Sure.
not going into our system.
Yeah. I mean, I would add e-waste to that as well, right? You don't want to put batteries or
Yeah,
things like
good
that
point.
into the system. But to Tom's point, that's where if you have a fleet of AGVs, they could be utilized for those smaller, uh, bulkier items, smaller loads, less loads, but bulkier
Yeah.
items that wouldn't go well into the system. So, any other questions at this time?
I don't see any more popping up. Hey, this has been fun.
Yeah, I mean, I think I would definitely encourage anyone to reach out if you have any other questions or want to look at a project specifically from an ROI perspective. And as Tom kind of led in this, um, or closed rather, about future webinars in this series, we obviously also welcome any suggestions or feedback as to what you may want to see on future webinars. Hoping that we're doing a great job of informing all of you as to the technology and would really love to make this as beneficial for you. So uh, open to suggestions or topics that you'd like to see on future presentations.
Great point. Thanks for attending, and yeah, we appreciate your attention. Take care.
Thank you.